These kids in Baltimore are swapping their noses just as Milwaukee Public Schools are now, requiring 10% of classes to be tested every week. Some parents have objected to having the testing as a requirement for in-person classes, but others say it's worth the peace of mind.
Stay on top of the cases, know what's going on, and then have a plan when things do go wrong. It's the only way to keep going.
We spoke with the company testing the samples, Ginkgo Bioworks in Boston.
Take a situation where previously we've been very much ignorant and provide a whole lot of information to help people just feel a lot better about being back at school. And we're so happy to be partnering with Milwaukee Public Schools to help bring those kids back to school.
The company says the kids' privacy is protected because they take the samples from an entire class and pool them together, never identifying which individual sample is positive.
And all we know is whether that group of 25, that class of 25 is positive or negative. And that's the very information that we communicate back to the administration.
Positive case in MPS leads to a suspension of in-person learning for 2 weeks for that class. Parents here at the Academy of Accelerated Learning were already notified of the positive tests Monday, leaving some parents with a decision.
We pulled her out and went back to virtual. It's not worth the risk.
And I still am nervous, but we're just going to try to go day by day.
Nick joining us live again. So if neither the lab or the school knows which student in a class tests positive, what are parents then supposed to do?
Right. MPS is advising parents if their student is in a class that does have that positive test for the class, they say they should get their child tested individually. But either way, they say those classrooms will be shut down for 2 weeks.
Nick Bohr, thank you. The state has received more than $175 million in federal funding for COVID classroom testing. Testing would be offered on a voluntary basis and not mandated. Schools will be able to choose from different testing options for spring and summer. Further options will be available in the fall. State health officials report a 56% increase in COVID cases in children 17 and younger over the past 5 weeks. WISN 12 News' Diana Gutierrez spoke with an infectious disease specialist about what might be the cause.
COVID cases rising in kids. The latest information that you want to get out to parents right now.
The disease is still milder in children than it is in adults, and that still holds. But what's happening is just an increased transmission rate among children. And again, that could be due to variants, but most likely is due more to really letting our guard down. I keep hearing, I'm done, I'm so over with COVID. Well, you might be, but the virus is not. Only children 16 and 17 are able to be vaccinated at this point. So our population of children still is vulnerable, and the virus will take advantage of that.
Do you, as a health professional, kind of expect individuals to let their guard down a little bit?
We do. Again, the virus is smart. We really need to keep at it in terms of our prevention and control measures. It's important that leaders, coaches, teachers, principals, school districts, and everyone, parents, keep sending that strong message. When you're around other people, you need to still continue to wear masks.